Hi, my name is Iza and meet our team members.
Hi!
In this video project, we would like to present to you about radiopharmaceutical as one of the application of radiation and nuclear physics. And these are the contents that will be discussed throughout this video. Without further ado, let's just get into it.
Hi, I'm Shahrir and I'll be presenting about the general knowledge about radiopharmaceutical for treatment. Okay, so what is a radiopharmaceutical? It is a type of radioactive medications or radioisotopes that is used to diagnose or treat cancers. It can be delivered orally, intravenously, or interstitially. A radiopharmaceutical can travel to different parts of the body. Once it has arrived at its destination, it will release the radioactive agents to destroy the tumor cells, such as the thyroid cancer, brain cancer, lymphoma, or cancers that have spread to the bones. It can also be used to diagnose certain cancers. To determine whether or not the cancer is present, radioactivity can be tracked throughout the body after the drugs are administered. It requires a special imaging system, such as gamma camera or something similar. For diagnostic purposes, the drugs are called tracers and only contains a small amount of radiation compared to the ones used for treatment. Meanwhile, a radionuclide is a form of radioactive elements. Some only occurs naturally in the environment, while others are man-made, either deliberately or as byproducts of nuclear reactions. Radionuclides emit radiation at their own specific rate, which is measured in terms of half-life. Radioactive half-life is the time required for the half of the radioactive atoms present to decay. Radioactive decay is when a radioisotope transforms into another radioisotope. This process emits radiation in some form. Some radionuclides only have half-life of mere seconds, while others have half-lives of millions of years. That is all for me. Thank you. I'll be passing on to Iza.
Hi, it's me again. For the next part, we want to know the concept of therapeutic nuclear medicine along with application in radiopharmaceutical therapy. Therapeutic radiopharmaceutical is a treatment of a disease that uses radioactive drugs. It is mostly labeled with a radionuclide that decays with the emission of beta- particles, which has a short penetration into the tissue to deliver all the energy in a small area. The properties of therapeutic radiopharmaceutical is listed as given. The first one is it is composed of a radioisotope that bonds to an organic molecule which conveys the radioisotope to specific cells. This is very beneficial as they can target specific tumors such as thyroid, lymphomas, or bone metastasis by administering the radioactive substances to the patient. For therapy purpose, radioisotopes used in radiopharmaceutical have a short penetration into the tissue like alpha or beta emitters that release all the energy in the proximity of their target, causing the cell to destruct and impairing their function. This is very useful for cancer treatment, pain treatment in palliative care for bone cancer or arthritis. Another property for radiopharmaceutical is that the isotopes retain longer in the body than the diagnostic ones to increase the treatment efficiency. So, how does radiopharmaceutical react to our body system? Radiopharmaceutical for therapeutic purpose transport targeted dose of radiation directly to the tumors and their metastasis without destroying healthy tissues. The molecule that carries the radiation targets the tumor is determined by its affinity or binding power to the tumor's target structures such as antigens or receptors. And then, the radionuclides that link to the carrier emit ionizing radiation that can kill the malignant cells by damaging their DNA and causing the tumors to shrink. These are some of the types of radioisotope used in radiopharmaceutical for treatment. The first one, as we can see here, is phosphorus-32 to treat myeloproliferative disease where there is an overproduction of blood cell in our body. Keep in mind that it is a pure beta emitter and its typical activity is around 70 to 180 megabecquerel. The external radiation is low due to the brand star lung, and phosphorus-32 can be difficult to be removed from our skin, and it has a mobility to migrate through our skin. And the methodology for this treatment is intravenous injection. The second one is iodine-131, a therapy for thyroid cancer. Iodine-131 can be in the form of liquid or gelatin capsule, and its typical activity is up to 6 gigabecquerel. The methodology for this treatment is iodine is extracted from the gut into the bloodstream and taken up by functioning thyroid tissue. The last example for the types of radioisotope is rhenium-188. That is a therapy for palliation of bone pain. This treatment is very significant for bone pain relief without no side effects. Typical activity for rhenium-188 is 1.2 to 4 gigabecquerel, and it has a short half-life, and it is a beta and gamma emitter. However, the gamma emission is relatively at low level. The methodology for this treatment is through intravenous injection. That is all from me. I will be passing this presentation to my friend Hanis.
Hi, I'm Hanis. I will be presenting to you about risk and issue involved regarding radiopharmaceutical treatment. The important risk and issue of radiopharmaceutical, which is the chance of developing cancer. When the higher of radiation dose, the greater the chance of developing cancer. Next is allergic reaction. It was extremely rare and usually mild. Always tell the nuclear medicine personnel of any allergies that you have. Third is exposed radiation. In nuclear medicine tests, it exposes patients to radiation. Besides, imaging of pregnant women with ionizing radiation should be avoided if possible. Then, be restricted to close contact and breastfeeding. It could be unnecessary radiation passed on to the child. For specific preparation, you must follow to be ready for the procedure. Furthermore, the consequence of irradiation. At the cellular level, the type and age of the irradiation cells, the concentration of oxygen in their environment and their cell cycles. In addition, you must measure the syringe patient dose in a radionuclide defibrillator prior to injection. This is because the radioactive nature of the products they are constantly saying. And the last one is accuracy rate. As we know, nuclear medicine does not provide a 100 accuracy rate.
And these are the references that we use for our presentation. Now we know what is radiopharmaceutical and the application in nuclear medicine. That is all from us. Thank you for watching.
Bye.
Bye.